what's the one thing you could focus on this year that would affect your overall practice and create incredible growth for your practice? But it's one thing. It's not 20 things.
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a dated dental nerd, and your host.
Welcome, everyone. I am so excited about today's episode. For those who are first listeners, I want to give you a big welcome to the podcast. We are truly about growth in dentistry, using data-backed solutions and welcoming guests that have very unique perspectives that are data-driven to help you and your practice grow and improve. Now, before we jump into the content for the day, another thing to always highlight, I'm super grateful for Dental Intelligence. They sponsor the podcast, and they always have a great gift to give everyone. They offer a $50 gift card for anyone who's willing to jump on and get a demo. Just go to get.dentalintel.com/podcast, and that will be in the show notes. Okay, without any further ado, I want to welcome Melinda Heryford. Now, I've known her for years. I met her pretty much when I was brand new at Dental Intelligence, so almost 6 years ago. And Melinda has been helping dental practices for over 30 years now. One thing that I love about her is she is data-driven and she drives meaningful results. And this isn't just to the bottom line. She's also focused on team culture and goal setting and helping make sure that the experience of the team and of the patient are as high quality as possible so that it's enjoyable. Life shouldn't be a drag, and Melinda certainly lives that in her personal life, and that comes through in the way that she works with practices. So I'm excited to bring her perspective to the podcast today. Now, Melinda, let's go ahead. Oh, actually, one other thing I want to call out before I introduce Melinda. One of the reasons why I wanted to have Melinda on, she is putting on an event, and we'll talk more about this at the end, but just to let people know, she's putting on an event in January where she's helping people understand, and you can talk more about this, the CEO's mindset. And it is going to be in Sacramento, and I want to make sure that people understand, hey, if you want to start your year off right, definitely consider coming to her event, and we'll talk more about what that looks like I said, a little later. So, Melinda, welcome to the show. Thanks for joining me. Tell the audience a little bit about the way you approach practice management, the way you approach helping businesses, and there's some things I want to fish out if you don't say them. So I'll turn the time to you, give a little intro, and let's chat.
Okay, thanks so much. And so great to be here with you, Steve. So appreciate what you do for Dental Intel and actually for all the practices. And so, I've been doing this a long time. I started, Steve, in dentistry when I was 14, if you can believe it. It's been a long and really beautiful career. And dentistry's given me a lot. And so I'm grateful for that. We get to change lives, and not everybody gets to do that. Even you and I get to change the lives by the things that we're affecting with these dental offices. And so, it's so true what you said about being growth oriented. I care about not just the practice getting better and growing, but I care about the individuals growing. And so our program really is fully designed for that. And so, I grew up on a ranch. I am in that entrepreneurial mindset for generations. And so that comes natural. So taking care of a business is super exciting for me. I like it. Okay, what do we do here? There's all these things that we could, we think about them like levers. There's all these levers to pull. What do we do? How do we make that, if we push this thing and pull that thing, what does that do? And then in the last 5 years, Steve, because of COVID and just really the crazy intensity of all the things that we're focused on, we've really practiced what's the 20% of the levers that make 80% of the result, so that we can really lean out our program and have people do the least amount of things, like our team members, but get the best result. Does that make sense?
Yeah, that makes perfect sense.
Yeah.
I love that. For those who haven't ever heard, what she just shared is called the Pareto Principle, Pareto. You can look it up. And it's this phenomenon that just exists across all sorts of areas. And it's that in general, you're going to get 80% of your results from 20% of the people or 20% of the effort. And I love that focus. Where can we with dental practices find the 20% of the things that are to give us the biggest results in the practice. Like that's a great way to start. Now, it is, when we release this, it's going to be 2024. It's a new year. Folks are thinking about their goals. At this point, maybe you're listening and you're like, yeah, I've already quit on like half of the goals, or we haven't fulfilled on them. One thing that I love about you, Melinda, is your approach to structuring, like, hey, what do we want to accomplish? Can you tell us more about the way you approach like vision or goals? I think is one of the way you put it. The phrase you use is your wig. So I want to hear more about what that means exactly.
Well, I've had a long career of supporting a dentist and setting some goals at the beginning of the year. And it's easy to set that goal and forget it. There's no it was just a great session where we felt good because we created all these goals, but then nothing happened. That's super frustrating. It's super frustrating for everybody, so we have really designed a system, and we used to work on vision too. What's your vision? So dentists are like, are you kidding me? What's my vision? Like, yeah, I want to make the world better, but that I want to make the world better is not very tangible, right? It's not very measurable. And so I have really, like, that 80-20 piece, I really took it to, like, I cut some of that vision stuff out, and now we go for the wig. And so when we're in the CEO strategic event, it is designed for every doctor owner to create their wig for the year. Wildly important goal. So what's the one thing you could focus on this year that would affect your overall practice and create incredible growth for your practice? But it's one thing. It's not 20 things. It's one thing. And so that's really where the art is. It's like, what's the one thing you could focus on in this practice? And it is different for each practice, that will produce that measurable result. So that's the wig. And then we have a whole structure, Steve, to really take that wig and what does that look like daily, and then who does what. So we've really, even where we call them MITs, most important things. And so each team member has at least 1 to 3, no more than that, most important things that they do every day with some tangible, like, numbers around it, measurable, that they do every day, that they track, and they report in. We have a dental dashboard system. We use Dental Intel to populate, that's part of how they track their results, but they populate their dental dashboard system to say, I made it, I'm green, I'm yellow, or I'm red. And if they're red, that's like, what are you going to do this next week to make a movement in that number? And so it really distills back that plan that used to be forgotten to really, like, how is that meaningful for every single person on the team?
Now, I want to jump in. Everyone, we just heard 2 things that are actually wildly powerful, and I don't know if people will grasp this. Let me just restate them. So number 1, you talked about setting a wig, a wildly important goal, and having mitts are most important things. And most important things is, you mentioned, like, 1 to 3 things every day that someone's committing to, where it's like, if I don't get anything else done, if I can get these things done today, then I can call it a success. Now, let me explain a little bit, like, psychologically what's happening. So one of the things that I've learned in my personal life, and I hope others can relate with this, is every single day we have the opportunity to basically, like, stack our confidence in ourselves. Here's what I mean. Yeah. If we say we're going to do something and then we do it, we give ourselves a reason to believe in ourselves. Does that make sense? Yep. And it's like, if I can teach a dental practice team, my team members, that every day, right, over the course of, however many days we work, 220 days, 170 days, whatever your practice is working, if we can teach our team members that every day we're going to get those 2 to 3 things done, right, you're going to teach them not just accountability, but you're going to give them legitimate confidence in themselves, right? They're going to all of a sudden start to realize, wow, like, I can do things that are hard. I can do things consistently, and they're going to start stacking their confidence. And that's how progress starts to really elevate. That's how progress gains faster momentum. Yep. And I'll tell you, that is the way that it works in my personal life. For, like, physical goals, like, I'm a big, like, I like triathlons and that type of stuff, marathons, and I'm doing an ultra marathon in January. And that's how I gain confidence. Like every day I just go get on the treadmill or I put my shoes on, I get outside and I learn to trust myself. I'm like, okay, like I can do things.
Yeah.
And then with a wildly important goal, it's so important to realize what I would say is that we are way more capable than we give ourselves. Everyone is, okay?
Everyone.
Like everyone is.
Everyone
and,
is.
And I give sports examples. If you don't like them, I'm sorry, because not everyone relates to them, but it's what I do. So,
yeah.
So literally, 3 years ago, I had never ran a marathon. I'd never gone that far. I had never swam more than a mile for Boy Scouts, right? That's the only time I'd done it.
Wow.
I had never biked more than 50 miles. And one morning I was like, hey, there's this guy locally, the Iron Cowboy, that was doing 100 full distance triathlons in 100 days. And I was inspired by it. And so I was like, I'm going to go join this guy. I'm going to go try to do at least one of the days with him. And it was wicked hard. I was so exhausted during the bike, like 80 miles in, that like I was bawling. I couldn't control it. Like I wasn't emotional. It's not like I was sad, but like my body was so depleted that it was just crying. But what I learned that day was that I got through the whole thing. It wasn't pretty, but I got through the whole thing and I did something that I never thought I was going to be able to do. And I think with dental practices, as we're setting goals, maybe it doesn't feel that same as having this like physical reward finish. But I'm telling you, when you hit business goals, in my experience, there is a great reward. And when you set a wildly important goal, something that might stretch you a little bit, but you believe you can hit, it's got to be obviously somewhat attainable again.
Yes,
totally
yes,
bogus.
yes.
Like I don't think we can expect to go from like 1 million in production to 4 million in production without adding any associates or team members.
Correct.
Like probably crazy. But anyway, sorry for the riff, Melinda. But I just wanted people to understand that what you just taught, WIG and MIT, are really, really big principles where if they can get excited about those things in their business, it can create a really great culture to start cultivating success. So I want to like dig a little more. Tell me a little more about, you said, hey, we've got like a process for some of this. Can you speak to some of that process, maybe some practical things that might be helpful for folks?
Yeah, you bet. So, it starts with that. I mean, I love your enthusiasm. And part of that, Steve, is because you have experienced firsthand doing something difficult and then actually preparing daily, doing something daily. And so that's really what we're talking about, is that there's something daily that's achievable. I mean, even dental intel follow-ups, for example, is one of those systems, right? Getting people to do follow-ups is a bear. It's a bear. But can we make this achievable in a way that they actually then have to report in on it and then get to discover the success of that? So when we have a WIG, then there are certain levers. So we have a prime practice. It's called priming the practice. Basically, It's like, what can we do to drive growth, whatever they said their WIG was. And so, so each practice is different, but it could be about case acceptance. It could be about scheduling. It could be about collections. It could be about recare, right? We have our fundamental pieces of areas, places that we can tap into for the practice to grow. And so that stuff is similar to what you would see in best practices. We have best practices in dentistry. They haven't changed that much the whole time I've been doing it, but the way we approach it and then having people really focus on it, I think that's the magic, right? The magic. And then having an office manager and some leads that actually drive this, right? They like look at the dental dashboard weekly and they have conversations with the team members. So, so our proven process is really where we're touching into one of those 8 systems and we're driving growth on those. And what I want to say about that is, it could sound like harder work, but I'm telling you, my clients this year are working less days, more vacation, and their days are easier. I had one as an example. His hourly production went up 78% in November, this November compared to last November. And so what the difference was, Steve, is that he actually leaned in because of, we have masterminds monthly. The doctors get to hear what other doctors are doing to drive that growth, but it comes comes down to what's the wig, what's the structure. So part of the structure that guy saw, that owner saw, is that he needed to hold his team accountable to the ideal day. Okay, that, we know that. We all know what to do. I think the doctors know what to do. I think we all know what to do. But really, then, can we do it? It's this piece. What do we do to make sure I'm doing that and my team is doing that? So in huddle every day, he looked at the day and he's like, we didn't honor the ideal day. So go, and then we'd look out for the next 10 days and he would make them change the day to honor the ideal day so that we actually have rock blocks in there. So that's actually what makes that is what makes the days easier, is that the spread of those different procedures, the ideal day, right? It's like has some of all of those procedures in it. But fascinating to me, the change in his results, right? Because I could see all year his results, his hourly. He took a bunch of vacation this year where he hadn't had it before because he has an associate. The practice is wildly successful, but it was the gross wasn't going up as much as I expected. And really, it's like when he put some muscle into that, it's unbelievable. It's unbelievable. He had his best month ever, but of course it's like, but then you look at 78% in your hourly production, that's not that easy to move.
No,
right?
It's not.
Not that easy to move.
It is not.
So, so that I think that really typifies, like we're working on some stuff. The doctors and the leaders need to know what are those things that we're working on so that they can drive the results. The dental dashboard system is a way to say, how are people doing and what support do we need to give them to grow? And I mean, I love this idea of building their confidence. It's like if we can instill that mindset, then it becomes easier because we really are growing people. That's what we get to do. We get to grow people if we want to. We get to change lives and grow people. I mean, how cool is that?
Yeah.
Right?
In fact, I'll share this with the story you just shared. Like, I can imagine that team probably wondered, like, is this really possible? Could we hit the perfect day more consistently than we probably ever have in the past? And what's amazing is that now this new record is now in their minds probably the standard. Like, oh wow, like we can do that hard thing, or we can do that thing. It's achievable to us, and now it becomes the new standard. Where once upon a time it was a wig. I think that's important to call it too. What was our wig 2 years ago can become our standard, and we can keep pushing the needle.
That's it. And the other thing that they were doing, Steve, which I think matters, we call it the whirlwind patient care. It's the whirlwind, right? It's cool. What they do.
That sounds chaotic. Help me understand that one. I love it.
Well,
the whirlwind.
it's like every day we take care of patients and we see them, whether it's an emergency, whatever it is. It's it's like patient care is what we do. It's what we do all day long, right? But working on the business, so this is a business term, working on the business gets forgotten because we're so deeply working in the business that we can't even take a breath to think about what was I was supposed to do my follow-ups today. I was supposed to do my follow-ups first today, right? As an example. And so what this team was doing is it getting caught in the whirlwind. They were saying yes to all kinds of patients. Patient calling, oh, they have a toothache. Can we go? Can we see them here? Can we take this spot? And the doctor would say, yeah, sure. Right? I mean, you never want to ask your doctors that kind of stuff because the truth is they'll cave too. So the ideal day is set up to have an ideal day. And the way you do that is you honor the ideal day and you don't say yes. So you don't cave in to the whirlwind because the whirlwind is just beating on you all the time. And so it's what is this muscle of doing these things that I said I would do that will keep my job in good shape, keep our practice in good shape and keep my job in good shape. And so that does take muscle. That takes the muscle, and you do it at the beginning of the day, or you got to figure out when you're going to do that. But really it is. So once we identify the things that are really going to drive the results, how do you make sure that those get prioritized? They are called the most important things. But as you know, with the time grid, the most urgent is what gets our attention. So when we say the
Yeah.
whirlwind, it's the most urgent, right? So patient care is the most urgent, it gets our attention. But what's the most important? And how do we give room for that? And
Hmm.
so that's really where we empower and train the leaders to be super clear. What's the wig? What are the mitts? And how are you driving that action? Does that make sense?
Yeah, that makes perfect sense. One of the call outs I'll give to people as I was listening to you was this thought just came to mind. I often give people the invite as you're managing the business and working on the business. Dentistry is one of these businesses where it's really easy to fall into a very reactive space
Yeah.
where there are so many things that can come at you where you can just live in reaction all the time. And
Yep.
it's a very stressful place to live. So I love this mindset you're sharing of, hey, the ideal day, while yes, it's about production and hitting some goals there, we're also trying to engineer or architect this experience for the whole team
Yep.
so that we can stay on track, so that doctor has a meaningful work day and there's some ebb and flow with clinically what people are doing. And the goal is to also engineer an experience so that we're not just
Yes.
like being reactive every day. And obviously you can't avoid the reactive part of work. Like there's
Right.
absolutely going to be that. But the more we can be proactive about our days and our schedules and our experience, the less stress we're going to feel, the more excited about work we can feel, the more likely we are going to be to hit our goals, right? So
Yep.
I think there's so
Yep.
much benefit in behaving that way.
Yeah, and I think that you're so right. And dentistry is just really interesting because the patient care piece is so profound. Like
Hmm.
there's no way to avoid, your patients are here, you've got to take care of them. And when I say to team members like, how are you doing? Oh, I'm exhausted. I'm exhausted. Right. And it's really that piece of um it's a flip of mindset, isn't it?
Hmm.
It's a flip of mindset to say, okay, the patient care is definitely what we're here to do. How do
Hmm.
we design it to be life fulfilling, life giving,
Yep.
and which means how do we make our goal every day? And it's how do we make our goal not just to make our goal, how do we
Hmm.
make our goal because it's designing the best day and the best experience for the patient, and we're actually then growing our people to do that.
Hmm.
It is this whole idea. It's probably like how you train for a marathon. It's like one step at a time, but you do have to prioritize working out and
Hmm.
getting that done every day. And that's really what those most important things are. So it really is, how do we engineer the day so each team member can get their most important things done so that we make those goals at the end of the day.
I love that. Now, why
Yeah.
don't I ask? I want to ask a little bit like, what are some of the most important things you see? Maybe highlight a few
Yeah,
roles. Like, what are some
you
of those
bet.
things that you think are good suggestions for most important things every day? And then
Yeah.
I'll finish with our final question, if that's cool.
Yeah. So we follow the 40X method, 4 disciplines of execution, because
Hmm.
execution is really where it is in business, right? It's like, how do you execute on this stuff? So the WIG is like, okay, what's our goal? But then the most important things are, it's really helpful if you can choose lead measures, lead things. So that's a
Hmm.
business term, lead measures. So in dentistry, like case acceptance, we call it getting to yes in our
Hmm.
system. Getting to yes is a lead measure. If people don't say yes to treatment, we don't have anything to do. Right?
Yeah,
We don't
productions,
have treatment.
collections, accounts receivable. None of those things happen. Yeah.
Yeah, where collection is a lag measure,
Hmm.
production's even a lag measure. So if we can lean in to some of those lead measures, so for us, it's a case, anything to do with getting to yes, which is all about case acceptance, and whether it's case size, whether it's production per visit,
Hmm.
we look at some of those metrics every month that come from dental intel because that provides us that lead measure, and doctors have goals around that. Doctors have goals around their hourly production. I got it kind of called out on this last year with one of my colleagues. It's like, you should not do production and you should not do case acceptance. It's like, that's just about money. And I'm like,
Hmm.
well, I kind of disagree. I disagree. I actually think that we can absolutely be focused on hourly production
Mm-hmm.
and have it be about patient care. I totally disagree with that. I think that our measurement is if people say yes to treatment, we're expecting the doctors to diagnose what they are trained to diagnose, conditions and decay and those things. Well, if they've taken the time to diagnose it, then let's figure out how to get our patients to
Mm-hmm.
wrap their minds around that so that they can say yes to their own health. And so
Mm-hmm.
that's my wraparound. So some of the wigs are case acceptance, case size, percentage acceptance. Patients acceptance is a bigger, it's like
Mm-hmm.
not as good. We will drill down on that one because there's some better measures than that.
Mm-hmm.
Like that's our beginning measure, is like patient acceptance. And then hourly production is one that we work on a lot. Collection is a very, very lag measure. We have some
Mm-hmm.
systems. We have an 80-20 way to do collection. So it's never an issue. It's like our goal is no receivable other than what's billed to the insurance. And so we have a system for that where it's like no receivable. That's our goal, period. So that leg measure is done because there's good systems leading to that, and we don't have to send statements, right? Because we collect it as we go.
Yeah, I love that.
So
I think that's a great highlights. I would say like it's so important that everyone has. The other thing I'll call out is, I'm talking about giving people confidence.
yeah,
When people have the ability to measure their performance, it gives them a really like clear playground to succeed in. So I think that's also like a
yeah,
good call out.
yeah.
Oh, go ahead.
The doctors really hesitate around measurements,
Mm-hmm.
especially with their team. They like, oh, I don't want to do that. So sometimes we have to really kind of baby step that in
Yeah.
so that they can see that it really is a good thing. And how
Yes.
can this be a good thing for people? But I think that's just a piece. It's like when people, it's like stepping on the scales. It's like
Mm-hmm.
there's some measurements that are really healthy. How do
Mm-hmm.
we wrap all this system? Because this is a whole system. How do we wrap this system so people really embrace it?
Yep, I love that. Okay, well,
Yeah,
Melinda, let's finish with the question we
yeah,
ask everyone, and that is,
yeah,
what
yeah.
does growth in dentistry mean to you?
Yeah, I love that question, Steve. And I think you got to it earlier, which is growth to me really means um, people are growing, like our team members are growing fundamentally internally for themselves. The owners are growing and the patients are healthier. That is like, it's like win, win, win. So it's
Mm-hmm.
growing on all levels and as colleagues and peers, because that's, for us, we have a whole group of peers that we relate to, that they're winning too. Right. I
Mm-hmm.
mean, that, it's, I love it when a practice grows. That makes me feel really good, right? That piece when the
Mm-hmm.
practice is growing every year. That's kind of my internal measurement. It's like, is the practice growing? But is the practice growing? But is the practice growing? Right?
Yes.
But and then this other piece of personal growth is just this part of internally, like, are people doing better fundamentally?
Mm-hmm. I love that. That's a great response. Well, Melinda, before I do my outro, I want to come back to the event you have. So those that are
Yeah.
listening, if you listen to this after the fact, then you probably missed on a great event, but I'm going to get this out before so that folks can join if they want to. You're hosting an event in Sacramento. Tell us a little bit more about that event.
Yeah, it's January 26th. It's the last Friday of the month.
Mm-hmm.
It's an 8-hour day, and we
In
invite
Sacramento, right?
in Sacramento. Roseville is a suburb of Sacramento, and California is a great place to come so that they could, go do some fun things on the weekend. It's a place where we pull all the owners and their leaders
Cool.
together. We're training. It's a split group in the morning where I take the doctors and with some colleagues, and we really work on that wig because that's the
Mm-hmm.
owner's job, is to come up with that wig. The leaders are being trained in how to lead, manage, and hold accountable in another room with our trainers. And then we bring everybody together in the afternoon and we look at the organizational structure that will really execute on this and what are the myths for each of those doctors in each practice. So it's an awesome event. And our clients this year, Steve, had phenomenal growth from this. I talked about that 78% growth. That's a doctor that went through Elevate,
Mm-hmm.
and we had 35% growth in collection, 48% growth in doctor hourly production, to name a few. There you got to see some of the changes in our data. But yeah, I'm super excited. It makes a huge difference to start the year with that kind of focus.
It absolutely does. So if you're sitting there listening and you're like, hey, like I'm totally interested, or if you're not sure, I'll share this. One of the cool things I get to do with DI is I look at all of our customers, how they perform. And one of the great things I can do is I can segment out these consulting partners of ours like Melinda and see how are their clients doing. And across Melinda's whole client portfolio, on average, they're performing above every single industry average. So when I look at like patient retention, that speaks to like patient experience, well above average. When I look at the clinical diagnostic workflow as well as case acceptance, well above average. When I look at the ultimate outcome of annual patient value, $300 above the average per patient in a whole practice. So there's some great, what she's sharing isn't just like fluff, it's data driven and proven to work. So if you're interested in setting your wigs this year and learning how she's helping practices structure, absolutely join that event. She didn't say this, but she told me before the show that for our listeners, normally this is a $2,000 event for the one-day event, and she's going to let you guys join for $995. So we'll throw a link in the show notes. You can look at the event details. For sure, check that out if you're listening to this and have a chance to get out there. So thank you, Melinda, for joining us today.
You're
what a gift
welcome.
to have a chat, as always. This has been a Growth in Dentistry podcast. Thank you guys for joining week after week. Keep growing. We'll see you soon.